So do you need to wait for pain or symptoms to come? No. Well, guess what we can do with Trigenics? Not only can your trigenist, because that's what we refer to as a registered Trigenics practitioner, is referred to as a trigenist, or an RTP. And that's a specialty, by the way, of chiropractic or osteopathy or physiotherapy, or some of the other health professionals also study Trigenics. So there's a number of different health professionals. It's often, usually chiropractors, but what can the trigenist do? Well, the trigenist, through doing specific testing throughout your body, which your chiropractors that practice Trigenics have done for you, they can find out which muscles are neurologically facilitated. This is actually facilitated. Facilitated and contracted, or essentially short neurologically. And they can also test for which muscles are weak neurologically. And we have specific treatment, different types of treatment in Trigenics that can actually lengthen the muscle neurologically and change the signals by inhibiting these signals too many, lessen the number of signals going to this muscle, which causes it to lengthen naturally. Or we can send more signals from the brain to the muscle that's weak, making it strong. So we have either a TL procedure or a TS procedure. TL is for lengthening, and TS is for strengthening. And you know that you do your procedures, you interactively participate with your doctor. Yeah. And you know that in some procedures he asks you to press kind of lightly and he resists the movement in a certain way and has you breathe a specific way. And other ones he asks you to kind of pull sort of hard. And they're kind of different. And that means that you're either getting a TL or a TS procedure, depending upon whether we want to change the neurology by sending more signals to the muscle or sending less signals to it to change the way the muscle functions, to make it either longer or stronger. So, getting back here now then, what do these subluxations cause? They cause a reduction in the adaptable limits, and eventually a state of dis-ease will develop. This distribution of nerve flow is interfered, the body's unable to respond to stress, the adaptable limits are reduced, and then you develop this muscle-nerve imbalance that we're talking about, where you either have short or weak muscles, you have nerves that are sending too many signals or not enough, and that creates the subluxation, which reduces the adaptable limits again, and that's when problems begin to develop. Now, do you want to, and then you develop a state of dis-ease. And if you leave it and you don't correct the subluxations and you don't correct the neurological inhibition or facilitation to those muscles, then you move into, after this dotted line, the sick care paradigm. Now, how medicine is absolutely necessary. The wonders of medicine are incredible. There's a woman that's staying at the hotel that had a liver transplant. There's someone that I know that just had a quintuple bypass heart, and incredible what modern medicine can do. There's only one problem with modern medicine. And the problem with modern medicine is, guess what? Modern medicine exists in the sick care paradigm. How many of your doctors are calling you up and asking if you're taking your vitamins and doing all your exercises and making sure that are they calling you? You're not getting any calls, hon?
No.
From the doc? No?
No.
But you're not I can't believe it. Mira, no calls at all. That's incredible. And they haven't been checking. Amazing. Well, that's because of sick care. You see, the healthcare paradigm was practiced in China many years ago, where the doctor was actually penalized and fined if for every person that got sick in his community, he lost money. He would be paid like $1 million a year, but for everyone that got sick, he'd be taken away like $50,000 from his pay. So guess what? He was running around going, "Did you take your vitamins today, Myra? Yeah? You did that, hun? Did you do all your exercises? That's great. I want to make sure you stay in really good shape." And he was really interested living in the healthcare paradigm and not the sick care. Unfortunately, the way modern medicine works, doctors are rewarded for patients that are sick, not patients that are healthy, and that's how the pharmaceutical industry and everybody else works, and you're in here. And so the causes of early death are heart disease, cancer. Prescription drugs alone cause 100,000 to 300,000 deaths per year. I just heard yesterday on the news, it was 200 deaths per day in North America due to viruses that are picked up in hospitals. Caused by 200 per day die from viruses. So hospitals are the most dangerous place you can be. Anyway, unless you really, really, really need to be there. So this is a limited healthcare cycle. So this is when, you go into, you still have no symptoms, but eventually you go from dis-ease to disease. And that all starts actually with muscular and nerve function, vertebral subluxation, nerve interference, early degeneration. The whole person becomes weak. That's where you have your symptoms. That's where the $76 billion a year is spent on sick care, not on health care. So which paradigm are you guys going to live in? Health care? Okay, but there's certain things you have to do to live in the healthcare paradigm. See down here, it says lifetime once a week. What does that mean? Subluxations, how much can they develop? When can they develop? Do you think after one day of stress you could develop a subluxation?
Depending on the amount of stress. Depending on the amount of stress.
Do you think one day is enough stress to cause your shoulders to tighten up a little bit, hun?
A lot of stress.
Is a lot of stress? Yeah, in one day? So how does that affect the spine where the muscles attached to those shoulders? It causes a subluxation to develop. Do you think after a whole week of stress you might have some subluxation? I think so. So how often do you have to brush your teeth?
Twice a day.
Twice a day. Twice a day. How many times a week is that? 14 times a week? 14 times a week? Okay. For how long? For just a couple of days, right? And then you don't do it anymore? Or forever? Well, you have to do it all the time, every day, for your whole life. Oh, so it kind of becomes it becomes a life habit, sort of. Ah, okay. And how often do you have to exercise?
Every day.
Every day. What? You don't just exercise for a couple months and then you're in shape for the rest of your life?
At least 3 times a week.
At least 3 times a week? You don't do that just for a couple months and then you're in shape forever?
Doesn't work.
No, it doesn't work like that, eh? No? Okay. So how often would you have to have some? Now, can you correct these subluxations by yourself?
I don't know. I don't
No,
think so.
you can't. Once neurological inhibition and over-facilitation, this whole imbalance develops and the subluxations are there, you need assistance and help in correcting them. I've got one on my back right now. I'm going to get an adjustment right after this talk because I can feel it. I know where they are. But I can't fix it myself. And I'm moving right now. You see me moving like this because I got a pain right here in my back and I know I need an adjustment. And I can't just get rid of it. Haven't you ever had that where you've had something you just, and you go to see Dr. Sarvis or you see Dr. Lorraine and you go, please, I got to get rid of it. And then you walk out and go, oh, gosh, I needed that. Well, you couldn't fix it yourself. There are certain types of myoneural exercises that you can do that will help and that will assist and that will help to alleviate some of the subluxations, but all of them are not corrected. And so if pain is the last thing to appear on the road from health to sickness, should you be waiting till you have pain?
No.
No. So what we're finding is that optimally people should be going in for care and for help and assistance in correcting these subluxations once per week. If not once per week, twice a month minimum. And they've shown that if your subluxation exists for more than 14 days, that's pathophysiological effect occurs on the tissue surrounding that area. So it shouldn't ever be left more than 2 weeks. So that's interesting. But is going in and getting adjusted enough?
I would hope so.
It's not. It's not enough because you need to correct the neurological supply from the brain. You need to correct this to complete the cycle. If you just try and open the channels of communication up here and these messages are not getting through properly and too many signals are coming through and the muscles on one side are short and not enough are coming through and the other side is weak and that imbalance exists and all you do is just rattle that bone a little bit and move it and don't correct this neurologically, that's coming right back again.
Well, isn't that what Trigenics does for you?
It's exactly what Trigenics does. So Trigenics corrects the communication from the body to the brain and chiropractic completes the cycle by correcting and opening up the channels of communication from the brain to the body. So now you have a full cycle. Now how does Trigenics do that, you might ask? What we do in Trigenics, we have what's called a multimodal treatment system. Trigenics is not a treatment technique. It's not a muscle technique. It's not a soft tissue treatment technique. There are techniques that do that are very good, and sometimes you still need those type of treatments as well as Trigenics and chiropractic. But chiropractic treats the neurology, the massage and the soft tissue treatments treat the histology, means the consistency, the structure, the cellular structure of the muscles themselves. They treat, and the chiropractic treats the osteology. So let's put it real simple. Chiropractic treats the bones, massage and soft tissue techniques treat the muscles, and Trigenics, the missing element, treats the nerves. And that's why you got such great results, because what your chiropractors have been doing for you, your Trigenists have been doing for you, because a Trigenist is really a specialist, a chiropractic specialist that's had to take an extensive course and had to pass some very rigorous exams. And your Trigenist, your Dr. Sarvis, still even looks at the book sometimes while he's working on that, right? because he wants to get it right. So it's it's actually very complicated. And the reason it's complicated is because it's an interactive therapy where the patient actually participates in the treatment, as you well know. You actually generate the nerve reflexes that we want you to generate to change the way that your nerve sensors are signaling the brain. And when that tricks the brain into re-signaling different signals, sending different signals back to the muscles, normalizing the number of signals getting through to the muscles to allow those muscles to work properly and to also alleviate the pain. Why do you get the pain? Because when the muscles are contracted, they're irritating the sensors that are the pain receptors. So when the muscle starts working properly again and the bones all start working properly, the pain goes away. And that's why you were so amazed that all that pain in your leg disappeared so quickly, and the problems that you had in your neck and your lower back all disappeared when finally Trigenics was introduced into your sciatica. And when Trigenics was finally introduced into your treatment care, your plan, after your doctor had taken the Trigenics course and came back and said, I've got this new treatment, we're going to give it a try, you said, this is the greatest thing since sliced bread. And that's why, because he had now provided you with the missing element of total care. So that's kind of what Trigenics is all about. Is there anything I've missed here? How many minutes have we been talking? I like to keep it 30 minutes, but I think I'm over time. Anybody know? Has it? Okay.
Well,
What questions do you have? Do you have any questions?
About how many treatments would it take then? You're talking about brushing
How many treatments would it take? It depends upon the case entirely. Everyone that comes in for Trigenics care will receive relief in the first day, in the first treatment. If for any reason they can't, they usually have to be referred out for another assessment with a different type of specialist. There must be something else going on. But 99% of patients that come in will receive results in the first treatment. And the first 20% of the treatments, if the person needed 10 treatments, in the first 2 treatments they'll receive 80% of the relief. In the last few treatments, that's when the last little bits are difficult, but at the very beginning, the relief is very, very dramatic, as you well know. Some patients only need 1 or 2 treatments. Some patients, if they had the condition that's been chronic for many, many, many years and they've got a whole, what happens is that the muscles that are neurologically inhibited or facilitated, these muscles affect other muscles that affect other muscles and so on and so forth. And so this neurological inhibition and neurological dysfunction begins to spread throughout all of the different muscles in what we call the kinetic chain. And then what your trigenist has to do is when you first come in, you know you got a very thorough examination from your chiropractor, your trigenist. Once he took the Trigenics program, he did a whole bunch of different tests that you never had before. And when he did all of those tests, he discovered where all of these areas of neurological dysfunction were. And then he endeavored to correct them by using these TS and TL procedures where he taught you how to actually actively reproduce certain reflex patterns and send different signals up to your brain and back down to your body again, which changed the function. It improved your function, enabled you to function properly, and also dissipated your pain. It really varies, but I can tell you this, because Trigenics treatments are so much more effective because they get to the root cause of the problem, you're going to need a lot less treatment than you normally would with other forms of manual medicine. Each case is really different, but most people that come in as a last resort. Trigenics is more expensive than regular care because it takes longer. So people are hesitant to come in, and they'll come in only usually, most of the patients that come to me are literally the basket cases. They've been everywhere else and tried everything else and been to all types of different doctors and had it for years and years and years and years, and I'm the last hope. And they heard about this Trigenics and they heard about this new type of treatment, and so they were willing to come in and spend a little bit of extra time and investigate it. And so those patients that have had it for long periods, they may take anywhere between 10 treatments to 20 treatments. The patients that haven't had it for that long, maybe 2 to 5 or 6. It just depends. Right. Usually it's going to take a little more than 1, but some patients come and they're in and they feel great after 1 treatment. And the problem is that 1 treatment or those 10 treatments or those 20 treatments enough to keep them in the healthcare paradigm, to keep them in this paradigm here?
Well, that's why you go every 2 weeks.
That's why you have to still go. That's right. And why do you go? Because what do you do when you take your car in for a diagnostic check? You hook it up to a new computer now. They have all these computers, and the computer spits out, oh, you have a problem with your bearing, and you have this bushing is beginning to wear down a little bit. You better replace the bushing, because if you don't replace that bushing, it's going to affect all the other parts of the engine, and eventually you're either going to need a new car, or you're going to need to spend a heck of a lot of money fixing all of the other problems that have developed as a result of that. But when your body breaks down, can you trade it in for a new one?
Nope.
No. So what better investment can you make than an investment in your health? And as we all get a little bit older, we begin to realize that, don't we? Very acutely,
Very good.
right? Because you don't have your health, you don't have anything. You have nothing. All the money in the world means absolutely nothing. So let's answer any other questions.
Scoliosis.
Scoliosis.
Can Trigenics help a person with scoliosis?
What happens with scoliosis? That's from the front now. What happens with scoliosis? Would you say that the muscles in here are short and the muscles in here are weak on that side of the curve?
Yeah, I always thought it was a curvature of the spine.
So we can't correct idiopathic scoliosis completely, but we can certainly help restore a functionality to this area of the spine and reduce the level of that curve. I'm not going to say that we're going to take somebody that's got a 40-degree curve and correct it, because that's not going to happen. That's not realistic. But we can definitely help any patient with scoliosis by actually working on the muscles on one side that have shortened and the other side that's weak. See how it all fits together?
Well, I have a new patient, Dr. Sarvis.
Okay.
Who has scoliosis.
Good, good. And the scoliosis care is what we call structural care. Whether it's scoliosis or whether it's with the head being held forward, which is called forward head carriage, which so many people have. If the head is going forward, which a lot of people have after motor vehicle accidents, or if they do a lot of studying or work on computers, the muscles in the front are short and the muscles in the back are weak. They're short in the front. So again, we'll work on balancing that musculature neurologically to help the head go forward.
That's good news, though. It can be helped.
Anything else?
What kind of conditions can it help?
Can help any type of condition, from neurological conditions to even systemic conditions. Trigenics can also be applied from a Eastern medicine perspective as well as a Western medicine perspective. I've been talking about the Western medicine perspective, where we can help things like tendonitis and headaches and plantar fasciitis and elbow problems and hip problems and knee pain and back problems and so on and so forth. What I haven't talked about is the fact that we can help people with things like diabetes and multiple sclerosis and stroke patients and neurological conditions and various other conditions that we call systemic. How do we do that? Well, we also have Trigenics myomeridian work, which is coming from an Eastern medicine perspective. And what we do there is meridians in your body. There's 12 meridians. I'll make this very, very quick. The life flow of your body goes through all of the meridians on a circadian type of rhythm, on a daily rhythm, from one meridian to the other. And that's kind of the charge or the polarity, the electrical charge of your body, if you will, that's transmitted. You can't see through these wires right now that there's a field around them of electricity, but that all exists. And so these meridians that we refer to in Trigenics as myomeridians carry the messages, and we can test for those meridians to see whether they're deficient or whether they are overactive. Just like the nerves are either deficient or overactive, we can also test the meridians. And using the Trigenics TS and TL procedure, the Trigenics strengthening procedure, we actually tonify a weak meridian, and with the Trigenics lengthening procedures on the master muscles that correspond with those meridians, we can actually sedate the overactive. So this would be used on meridians that are weak, the Trigenics strengthening procedure. The Trigenics lengthening procedure is used on meridians that are overactive. And by doing that, we can actually balance the meridians of the body, and that enables a trigenist to treat the body holistically as well as locally. So just about any condition can benefit from Trigenics care.
Can you give us an idea of the cost?
Cost is normally $75 to $150 per treatment, and that's above your chiropractic care. So if whatever your chiropractic charges, if he charges $50 for an adjustment, then if he also gives you Trigenics, it would be another $75, would be $125 for that treatment. Depends upon for my athletes, for instance, they require a double treatment because they take that much longer. So it would be $150 for that treatment, and the fees are regulated by the Trigenics Association. in North America. And the reason that those fees are there is because they're basically equivalent to the amount of time that the chiropractor would be spending if he were seeing 2 or 3. He could see 2 or 3 patients in the time that he needs to see you to deliver superlative quality care. If he was just practicing chiropractic manipulation, he might see 2 or 3 patients in that time. So the way that the fee has been calculated is that it's been based upon the amount of time that the chiropractor has to spend with you. And he has to spend, as you know, more time doing the Trigenics than he does normally just giving you an adjustment. So that's where the fee system has come from. And we think it's a pretty fair one because most of the patients that come in have been everywhere else and have spent a lot of money on different doctors and have not actually received the results that they want to. So my question to you also would be, if you had the opportunity to receive care in a very short period of time and pay more for it initially, or receive prolonged treatments over a long period of time at the end of the day that would end up costing you more, which way would you prefer to go?
Shorter.
The shorter time. And that's what Trigenics enables you to do. So generally speaking, that's what the fee structures are, but those are all good questions. Anything else? No? Well, I'm glad that you have all been with us here today at the Trigenics Back to Health class, and I hope that the information that we've given you here today is something that will also be helpful for you in your Trigenics care. I'm Dr. Alan Olo Austin, the originator of Trigenics. Thank you.